Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. This is the Granite List Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace, and today I'm joined by Andy McMillan, who's the EVP of Sales and Marketing for Homestead Smart Health Plans. And Andy, I know you guys do a tremendous amount in helping employers and plan sponsors really maximize their plan. But today we're going to talk about a very specific vertical in our industry, and that is skilled nursing, long-term care facilities, health and human services organizations, kind of all bundled into one. Because I understand you guys recently published a white paper that addresses this industry vertical. So you all have created this white paper that is focused on a very niche portion of the industry. Can you start by giving us an overview of the long-term care industry and what are the headwinds that the LTC employers are facing right now?
Yeah, that's a great question. Thanks, Sally, for having me back. I always love being with you. There's three main issues that long-term care, skilled nursing, health and human services are facing right now. Number one, it's a war for talent. Number two, it's Medicare and Medicaid reimbursement levels. And then number three, and I think we all know this, just a massive increase in healthcare costs and insurance premiums, right? So when we're talking about the war for talent, there's an increased cost associated with trying to attract and retain employees. And many of these employees aren't necessarily loyal, and maybe they haven't been given a good reason to be loyal and to stick around. But the cost for turnover is huge. They have to hire agencies to go and recruit and attract these types of care workers. And it's a thankless job, really. And so if they can go somewhere else that may have, a higher wage or better benefits, they'll probably leave, right? Medicare and Medicaid reimbursements, and everybody feels this in this space right now. And it's been this way for a couple of years. In fact, the reimbursements have not kept up with inflation. I think we can all look at that and go, wow, we just went through a 4-year period of some pretty crazy inflation coming on the heels of COVID. But now in this political environment with DOGE, and there's a lot of uncertainty, right? Especially with Medicaid and what's going to happen. And that creates some anxiety and some fear. But the final piece of headwinds or challenges really revolves around the increase in healthcare costs and subsequently the insurance and the premiums or the reinsurance. And so what ends up happening is when an organization is faced with a 25% rate increase, what do? They're not passing it all onto the employees. They're going to probably split it, but they're going to also try to mitigate that rate increase by changing plan designs. And it never ceases to amaze me just how bad some of these health plans that I see every single day, how bad they are. Because in order to lower premiums, they've pushed cost to the member through plan design, through deductible, through increased out-of-pocket maximums and copays. So there's a lot that long-term care facilities are facing right now. Many have either filed for bankruptcy or thinking about filing for bankruptcy, or how do we overcome this, right? So there's a lot of pressure right now in that niche.
And that's scary because, so many of us have loved ones that are beneficiaries of those services. And so I think, as I was looking at the white paper, one of the staggering statistics for me was the fact that 20% of nursing home employees carry medical debt. We have this misguided thought that people in the healthcare industry always, are on top of the best access to healthcare services and know how to manage their own finances. But the white paper shows that simply isn't true, that they also are being impacted by what you just described. So why is that?
Well, so think about it this way. When you're looking at plan design and you're pushing more and more of the cost burden up front on the member, if I'm making $16 an hour and I have a $5,000 deductible and I've got a really bad knee, what happens? So you got to make a choice, right? So you either save up for a long period of time, or you go and you have the surgery and you get on a payment plan with the hospital and you take on medical debt. And 20%, over 20% of skilled nursing workers carry medical debt. And it's alarming, and it just doesn't seem right, especially with the kind of work that they do every day.
Well, I know the kind of work you and your team do every day. I know part of the cornerstone of what you bring to the table is a reference-based pricing element.
Right.
But I also know that we're speaking to a wide audience that may be unfamiliar with that. So can you break down what reference-based pricing, or RBP, is and how it works, and then how it's different from traditional models?
Sure. So reference-based pricing, the name kind of indicates what reference are we talking about, right? We are talking about Medicare. So we're pricing a reimbursement to a doctor or facility a certain percentage above Medicare. Now, how is this different? It's different from a regular traditional health plan in that the Blues or United or Cigna or Aetna, they've already negotiated what those reimbursement rates are. And it could be anywhere from 240% above Medicare to a lot more than that, maybe 400% above Medicare. And when you have that kind of reimbursement, there's a lot of costs that go into that. With what RBP, or what we do with reference-based pricing, is if you go to a facility and you have a surgery, we're going to try to create a win-win-win situation, a win for the doctor, a win for the member, and a win for the employer, right? So we're going to start out by reimbursing that doctor at 125% of Medicare, or reimburse that facility at 125% of Medicare. There are some times that we've got contracts with certain physicians or certain provider groups, or even hospital systems. And it may not be that skinny, right? It might be a little bit more, like 160 or 175, but still that's a lot less than what the Blues, United, Cigna, and Aetna do. And so what we generally see in the first year of working with a new client is 25, 30% savings on their entire medical spend. So when you have savings like that, that makes it a little bit easier to breathe, especially if you're struggling financially as an industry.
Absolutely. All right. So I want to take it to the employer-employee level and go back to the case study. In the white paper, you all highlight a nonprofit community care provider that saved over $21.5 million in 7 years by switching to this model that you just described, reference-based pricing.
Yeah.
Help walk us through what the key drivers were to those savings, and how did that translate down to the employee level?
Yeah. So this is a great case study. They're one of our favorite clients. So this organization was hosting a fundraiser. They're a nonprofit, okay? And they were hosting a golf tournament, and they had all their employees at all the different holes around and when they found out that I worked for Homestead and that my golf mate worked for Homestead, they came up to us and they said, "We love our health plan. We love our health plan." And employees generally like it. That doesn't happen necessarily overnight, right? It's a transition, and there's education that needs to happen. There's basically helping employees understand how the process works, but then guiding them through that. And what this employer did was led by their CEO, who was very much wanting to find ways to create more goodwill for her employees and a way to lower healthcare costs. They started out with a dual option. Okay, so they offered RBP with Homestead, and they offered a traditional PPO plan. I think it was with Aetna or Cigna. And they gave the employees the choice. But the way they designed the contributions and the way that the plans were designed were done in a way that it would be a lot less out of pocket for an employee to get the insurance if they went the RBP way. So the first year, there was more than 50% that went to the RBP plan. And over the next couple years, it kind of continued to grow and grow and grow to the point that they actually didn't need to have a dual option anymore. And again, like I kind of gave it all away at the beginning of the answer to that question, but the employees love it. They love it. And, us at Homestead, we're on our own plan. We eat our own cooking. And I love our health plan. I mean, we've got a platinum level plan design. So two things for an employer: you can lower costs and you can increase the level of benefits that you're offering to your employees and their families. And guess what? That creates goodwill. And what they did was some of the savings from the RBP was they reinvested it back into their employees in their hourly wages. Now, this is a nonprofit that has grown like crazy, and they have their retention rates have gone way up over the last 7 years because of the increase in wages and the much better healthcare plan that they have now.
Absolutely. And you're helping protect both the plan and the plan members' bottom line by allowing money to go back into their pockets, which is remarkable. And I know it's not just the financial savings, but it's that employee satisfaction as well. Are there any other ways that you've seen this transition impact the day-to-day lives of long-term care employees?
We have quite a good chunk of our business are long-term care facilities, long-term care homes and skilled nursing and that type of thing. There's other ways that they can use that savings. I mean, certainly they could reinvest it back into maybe a capital expense, reinvest it back into the business. But the employees at these places generally really like the plan because they don't have a $5,000 deductible anymore. It's a fraction of that.
Exactly. And, you hit on something that I think just in general in the RVP space sometimes gets overlooked because there's such a focus on the savings, but you really double down on the education and educating the member. And I love the story of starting by giving choice and moving towards what you knew ultimately would be the best scenario for everyone. Because I think a lot of employers worry about balance billing and employee pushback. And so what does Homestead do to address that and help them have confidence?
That's a great question. And, when I'm talking with brokers, when I'm talking with employers, the biggest concern is how is this going to affect my employees and their families, right? And there's this fear that there's going to be so much abrasion that their members are going to be going to the doctor and they're going to be turned away, or they're going to look at their ID card and say, but yeah, you're not in network, or, we don't take that type of thing. And so one of the things that we created was a process that we call Clear the Path. And so during implementation, we'll take in all of their claims data and we will look at all of the doctors, primary care specialists, providers, even facilities where they're going. But as it relates to the doctors, we have a provider-only network that we put in place. So we like to say around here, reference-based pricing, or RBP 2.0. And so what that does is that eliminates that abrasion or that hassle or somebody being stuck in a doctor's office, not being able to be seen, because they have a network for that, right? It's really the facilities and the hospitals where the big dollars are. That's where the savings is realized, okay, when we reprice those big dollar claims. But back to the employees, the Clear the Path, what we're doing is we're reviewing all of those to ensure that we have those providers, their doctors that they're seeing on a regular basis, that they're in network. And if they're not, and there's probably, 11 to 15% of the time, or 11 to 15% of the docs sometimes aren't in that network. So then we do an outreach to them, and we explain to them who we are, what we do, and we either get them added to the network, or we'll do a single case or a single patient agreement with them. And we close that 98% of the time. So the 2% of the docs that decide not to come in, they're the 2% that aren't in anybody's network.
Yeah, that's awesome. So as we're kind of rounding out today's episode, if there is a long-term care skilled nursing employer, or really, I would imagine any employer for that matter, that's interested in exploring reference-based pricing, can you help educate us on what the first steps are that they should take in looking for a partner?
Yeah. We pride ourselves here at Homestead on being a member-centric, member-focused organization. Our tagline is care, not just coverage. Like, we really do care. Our people, I love what I get to do and who I get to do it with. We really care. And so what I would look for if I'm an employer exploring this is certainly come and talk to us at Homestead, right? Have your broker call us. What I would look for is this company focused on the member experience, right? Brokers, and employers alike, they just hate it when there's noise, right? In their health plan, when there's abrasion with their members trying to access or utilize their health plan. And so we have done a lot of things. Clear the Path is just one, but we do a lot of things that really enable that. And that's where I would start, is find an organization that really puts their money where their mouth is and invests in that member experience. And that's something we do every single day.
Absolutely. Well, Andy, thank you for being on today. This whole show was about, this niche in the industry. And I love the white paper that you guys have just produced. We certainly are putting that on Homestead's page on thegranitelist.com. So for those of you that are searching solutions and want to learn more about reference-based pricing from Homestead, it's on thegranitelist.com. And of course, they can learn more by visiting homesteadplans.com.
That's right. That's right. And that white paper will be on the website, on our website as well.
Perfect. Well, thank you very much for being on today's show. And thank you all for tuning in to another episode of The Granite List Live.
Thank you for listening to this episode of The Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.